start my video here. I'll pan into the screen here to show my audience members and then set up.
Oh, yeah.
What's that? Okay. It's all right.
All right. We're good to go.
All right. My story starts in the summer of 2018. I was working out in one of my friend's basements, as I have many, many times, and started to have some chest pain. Thinking that, this is out of the ordinary, I decided to stop the workout, came back a couple minutes later, and the heart palpitations were worse. I started to get sweaty palms, and a feeling of just sheer terror came over me. I went to see my wife. We rushed me to the hospital. After 2 hours of EKGs and CAT scans, I was told that I'm perfectly fine. I had just had a major panic attack. I chose this topic because my life changed that summer. And the thing that I learned through that is that through the American Association of Anxiety and Depression Disorders, that over 18% of Americans over 18 years old struggle with mental illness. And mental illness in the form of anxiety disorders is the most common illness that's treatable. Today I hope to inform you about what causes anxiety, some of the triggers for anxiety, and then how to treat it. So first of all, there's three sides. There's hereditary. There's a belief by Dr. Edmund Bjorn that 1 in 4 people whose parents have anxiety will also have anxiety. There's also a belief that it's more of a learned behavior. So if you have parents who have an anxiety disorder, watching them and seeing them, you develop this.
Wow.
There's also the idea that it's about major life events and stress. So if you have someone who passes away, you have loss of job, things like that major event will trigger it. There's also the idea that life is kind of like a pressure cooker, and if you don't deal with it, eventually you blow. There's another side that's the abnormality of the brain. It would be your neurotransmitters near the prefrontal cortex that really don't regulate the flow of serotonin properly, so you can't calm down. There's another side, the amygdala, which is your reptilian brain, your fight or flight. So if that's throwing off false positives, you're going to have a hard time making your way. So none of us are born perfect. None of us live perfect lives. To me, that wasn't good enough in my challenge, in my odyssey. So I went to say, all right, well, what makes anxiety disorders different from regular anxiety? Because normally anxiety is a good thing. I mean, you think about when you accept an award, when great things happen, sometimes you get anxious, and sometimes it's your body protecting you naturally. So what is a disorder? According to the Calm Clinic, an anxiety disorder is going to be when it's ongoing, when it's seemingly uncontrollable, and when it interferes with your daily life. Different types of anxiety disorders include social anxiety, agoraphobia, panic attacks, generalized anxiety disorders, and specific phobias. There's also maintaining causes. These would be the beliefs that after you've had a panic attack or after you've had anxiety, that you start to avoid certain situations that manifest itself into worse and worse situations. Having had many panic attacks and had anxiety for a long time, I can tell you that they pass. They always do. And no one's ever died from a panic attack. It really is a fear of the unknown. So how do you treat that? There's a few different ways. The most popular way is cognitive behavioral therapy. This is the idea that your brain is malleable. There's neuroplasticity. You can learn new things. And if you can learn to be scared, then in theory, you can learn to get over it. There's also the idea of learning to calm yourself out and be in the moment. If you're afraid of the future, learning how to meditate, learning mindfulness techniques can ground you in the moment so that fear doesn't go like a wildfire. There's also medication. There's the benzo class, which is more of your Valiums and your Xanaxes that you take, and 20, 30 minutes later you feel better. They do come with serious side effects, so they're from short-term use. And there's also the SSRI class, like antidepressants, Zoloft, Prozac. Those are meant more for longer term and have less side effects. So we've covered a lot. in my opening, I described a situation that changed my life. Hopefully, telling you a little bit about where it comes from, what makes it different, and how it's treated makes you feel a little bit better about what anxiety disorders are. According to several places, I understand we're supposed to have props, so since I've picked up this disorder a couple years ago, these are just a few of the books that I've read to try to figure out what this is. Over 90% of people that commit suicide have some sort of mental illness. If I said earlier that 18% of Americans have a disorder, only 36% of those people seek treatment, which means there are over 26 million Americans every year that go untreated. To me, that's criminal. We have to remove the stigma. We have to create a situation where people are okay opening up. How many people out there that we could save? How many people out there could live a normal life and not feel like they're different from everybody else? I know if you're watching this or you know someone who has anxiety, tell them to open up. Be there for them. Because I know for me, if you understand the characteristics, if you understand the triggers for you, that you can develop the techniques to move forward and really face the fear and live life anyway. Thank you.